For me, this is really about the important role that we play with strategic partnerships, that there's a time for businesses to compete, but more importantly, there's a time for them to do co-opetition, that they need to work together for the greater good, that the world would not be a better place if we continue to think, to think in silos. So to my mind, strategic partnerships with the public, private sector and the NGO space, really being able to galvanize and educate people more about how to stay healthy, how to prevent themselves in the first place from getting sick. Yes. Awareness creation is a co-creation that we all must do together. How do we work with government to create enabling policies that unlock the potentials of healthcare in Nigeria? How do we see that together we can start to reverse brain drain, reverse patient drain right now? We're spending a huge amount on medical tourism. Yes. We lose over $1 billion on an annual basis to other countries that have had concerted efforts of how to both affect the environment, but more importantly, grow private and public sector talks. So I think there's a lot that we can do together, and this issue of community ownership, that we should be able to bring some of these policies back down to the rural level. If we don't empower our people, if we don't create the enabling environment for businesses and health and to thrive, we will be in a harsh situation.
But one of the issues, or one of the key problems with the health sector, is that there's no one silver bullet. Every day I see a patient on Twitter trying to raise funds to go to India, and sometimes, unfortunately, it's because they've attempted the same procedure here, and then it didn't work out. So it's just a very unsettling thing to read. So what would you say we need to first do here? Is it that we need to implement technology, we need to go back to the curriculum, or we need to provide infrastructure so that our health system can actually work?
There's no single bullet that can shoot straight to quality healthcare. What every Nigerian requires is access to quality healthcare. To be able to do that, you need to have the basics sorted. So first, yes, you need to have the infrastructure, both at the primary, secondary, and tertiary level. Then you need to have the human resources for healthcare. We need to be able to keep and attract our Nigerians in country, our doctors, our pharmacists, our nurses, because it's not done by one person, it's teamwork. We need to keep them back in country. And then finally, we need to be able to make sure that they have the right tools to work with, that they have access to the latest technology for diagnosis. But more importantly, that after we've set up all these diagnostic centers, and we found the incidence of cancer rising, we found cardiovascular disease and challenges like that, that we're able to keep those patients in country by the combination of all three. Now, there is a lot happening, but there's certain laws, for example, that are prohibiting Nigerians from knowing where to go. So there's this perception of there's no access to good health in the country, which is not actually correct. There are pockets or oases of sanity around the country, but it may not all be in one spot. So we also be able to look at how do we leverage on technology to advertise to people where to go and what they can do. If you need to have an orthopedic surgery, if you need to have open heart surgery, if you need to do plastic surgery, where can you go? So you don't think of going abroad before you think of doing it at home. If people are aware, I can assure you that most of them would prefer to be here than having a curry in India, to access quality healthcare.
Now, you raised a couple of points that I just want to chase. One of them was regulation, yes. Right? I know that this is what private sector specialists tell me. They say, if the regulation is good with Nigeria's population, there is a market. Yes. So it will work. There will be funds, there will be investment, and things will get better. But then this seems to be happening very slowly. Yes. So what regulations are maybe holding the investment in Nigeria's healthcare sector back? Because it can't just all come from the government. And we know that healthcare as a percentage of Nigeria's budget is under the guidelines that some of them have, that the government has even occasionally signed sometimes. So what is really holding private capital away from the health sector?
Okay, I mean, there is quite a lot that needs to be done from the regulatory perspective. First, I think, is why the Healthcare Federation was set up. And that was really to be able to create that open dialogue between the private sector and government. 60% of healthcare in Nigeria is provided by the private sector, although the institutions are just 40%. But the biggest challenge is access to finance, both on the demand and the supply side. On the demand side, the average patient has to pay out of pocket. And every time they get sick, they become more impoverished. And there's a lot of inequality in society already. And therefore, we need to be able to close that divide by finding other means for them to be able to pay for healthcare and get an access to basic healthcare. And we think that if we make healthcare compulsory, healthcare insurance compulsory in Nigeria, make it mandatory, it will be one of the big things that can transform the way healthcare is provided. And there is a bill in the National Assembly right now that is really saying that government needs to make, healthcare insurance mandatory. And if this happens, honestly, it will be a major leapfrog, transformative thrust that will be required by anybody in any sector, because automatically you have an off-taker. You're sure of how you will get your bills paid if you were to provide the service. The second is the fact that just like other countries around the world, private sector requires certain incentives to be able to close that divide. So yes, you need affordable finance that is long-term in nature, but when you have to pay 26% to build capital, to actually fund your capital expenditure, it's not sustainable. So yes, we're looking for lower interest rates, but more important, long-term capital that can be able to provide the long-term investment that's required to build the infrastructure. And finally, incentives. There is a lack of incentives in the private sector, unlike other sectors. You have in the aviation sector, agriculture sector, telco sector, there's a huge amount of incentives being produced by the government on a daily basis. And yet in the private sector for healthcare, that is non-existent. So there are policies right now that we're working on. We just need that to be gazetted, pushed by the Federal Executive Council, and they should be able to give investors in the healthcare space access to duty waivers on equipment, tax breaks on that investment. So there's quite a lot that needs to be done. A few weeks ago, we had the privilege of visiting the Senate chair on health, and we had the same conversation. And I think there is political will, both on his part and also that of the Ministry of Health. We also met with the minister the day after. So it's not a lack of political will. It is really that the bill pushes the envelope for a lot of people. And so for some people, they're in favor, some are not. But being able to balance some of the challenges, I mean, you're changing one major word, can and shall. You're making it from being obligatory to being compulsory. For us, it is really who stands to gain. And the average Nigerian is not you and I. The average Nigerian can't afford to put a meal on the table, and it's really difficult for them to go through life. And healthcare is an essential part, is the fundamental human right that they should be able to get.